Hello, this is a talk about Chapter 3 and Chapter 8. Chapter 3 is Health, Education, Poverty, and the Economy. Chapter 8 is Nutrition and Vulnerability. And then in a separate recording within this module, we'll be talking about the roles of public health nurses, which is not included in the textbook, but which is important for you to understand. So again, we're going to describe the connections between health and the determinants of health, which create health disparities. We're going to talk about the cost and burden of nutritional deficiencies, and then in the other recording, describe the roles of the public health nurses. So health disparities is a type of difference in health that is closely linked with social or economic disadvantage. And so when we think about that picture of equality versus equity and health disparities, we know that health status can be different for people in different neighborhoods of our city and in different parts of other countries. We know that their access and coverage to health services is not equal across the United States even, and especially in other countries. And we know that health financing can vary. We know that a lot of money is spent on replacing cardiac valves in transplants, and less money is spent on public health. And so there's a disparity there. And then the distribution of health benefits. And the Affordable Care Act helped with that. And now we see whether that's going to be continue or not. And then again, health disparities can vary with the socioeconomic status, with a person's ethnicity, with their gender, with religion, with their location. If they live in rural parts of the United States, they can suffer from not having enough services, and that's often true in the rural areas in other countries. It's much more difficult to get health care. Their occupation and their social capital can affect a person's health status as well. In health education, this is a very important part of the public health nurse's role. We know that parents' health and education affects their children, and generations can be affected. We know that malnutrition and disease affects children's cognitive development and performance in schools over the long term, and vaccination can prevent diseases. And so health and education go together. Health, productivity, and earnings go together. We know good health leads to more health insurance, leads to healthier workers. When people are ill, they cannot work and they cannot earn and they cannot produce. And so it really behooves the government to provide health care for its citizens so that they can continue to produce and develop the country. Illnesses can lead to a decrease in earnings. This is basically saying what we just said. And then there are indirect costs to illness, such as transportation to get in to where the doctor and the hospital is in the city. Staying in the city. We know we have the Ronald McDonald houses to help families stay close to their children. And again, there's health disparities across countries. Some countries have substantial variation in health indicators across populations. So even in the Philadelphia area, we have neighborhoods with high infant mortality versus other neighborhoods. Norristown, in the African American population, has a higher infant mortality than in, say, parts of the city of Philadelphia. Urban versus rural, definitely more services in urban areas, and rural people tend to have lower incomes and less access to service. So it's important that the nutritional status of children, because as children grow, they can be affected for the rest of their life if their cognitive abilities are affected. Some key terms related to nutrition, and again, this is Chapter 8 now. Malnutrition refers to those who don't get proper nutrition, whether too little or too much, because we know that we've seen obese children that are affected by having too much food. And then undernutrition, being height for age lower than the 50th percentile, weight for age, and then weight for height. The immediate causes of undernutrition is that they just don't have enough food. There's just not enough food to provide the calories that their body needs. It weakens the body. We know that the immune system needs proteins and amino acids to be strong, and if children aren't eating proteins, aren't getting enough calories, then they are weakened. Illness makes it harder for people to absorb the nutrients they take in. People don't feel like eating when they're sick, so this can lead to undernutrition as well. Children who have pneumonia don't feel like eating. And then we have this cycle of illness and infection, becoming undernourished more, and then getting more illnesses. Adolescents are growing at a tremendous rate. They have a need for protein and energy to grow, to grow strong bones, to grow strong blood, so that they can be oxygenated, so that they can study and do the work that needs to be done in the home. Children who are stunted really can't make up for it later in life. And then adults in old age. We know that adults need a well-balanced diet with protein and iron. Especially women need iron to remain productive. And elders need a strong nutritional status so that their bones remain strong, so that they don't break bones and have issues. The ability of older people to live on their own can depend on their nutritional status. Keeping them in the community, in their home, helps to make strong communities instead of placing them into institutions where they aren't free to move around or have disabilities that keep them from moving around. We know that there are foods that contain too much fat, too much cholesterol, too much salt, and these can be harmful for people. And again, this is where the public health nurse comes in with program planning in senior centers, in groups where elders gather, where parents are talking about how to remain healthy, how to eat healthy, because a lot of people aren't familiar with how to do it. If they don't watch TV, if they haven't studied health, they really don't know what is healthy for me to eat. Should I eat eggs? Should I not eat eggs? And nutrition information is always changing, so we have to be ready to have programs to help people learn about nutrition. So public health nurses' actions for addressing undernutrition, especially with pregnant women, is to look at multiple micronutrient fortification with prenatal vitamins, with packets that they can add to their food to fortify their food so that they're getting everything that they need. We've seen folic acid be added to cereals to prevent problems for babies. We want to promote breastfeeding practices so that babies are fed exclusively by the breast for, I think it's at least 6 months, but then also encouraging breastfeeding for longer periods than is happening. Supplementation with vitamin A and zinc for children, and then appropriate management of severe acute malnutrition, carefully bringing children to strength again. And this is our last slide, and so we need to also talk about overweight and overnutrition, and that international organizations are seeing overweight and obesity in children and in adults, and causes including the food that people are eating as well as the lack of physical activity. And governments are promoting campaigns to promote healthy foods and healthy exercise, so that people can get out and be healthy. And school nurses, again, can encourage healthy eating in children. And again, we talked about adolescents establishing their healthy behaviors during adolescence, and so school nurses encouraging healthy eating and schools promoting healthy foods and healthy drinks. So thank you for listening.